I was told to talk on kingdoms. It seems Dr. Kishore Mehta is going to talk on the mineral kingdom. Animal. Okay, he's going to talk on animal kingdom. So, I decided to talk on the plant kingdom. It's a very big kingdom. 2/3, almost like 40 to 50% of our medicines in the Materia Medica arrive from the plant kingdom. When we say the remedies from plant kingdom, it could be anything. It could be the leaves, it could be the trunk, it could be the whole plant, it could be the fruit, it could be the berries, it could be the flower, it could be the roots. Any part which is originating from the which is a live thing, which is an alive thing. So, as you all know, every living thing has certain characteristics, right? And then there are certain characteristics of every kingdom. So, every animal, like an animal, every animal species has different characteristics. Every living being has a different characteristic. So, also even non-living things like an mud, sand, iron, steel, element, whatever, calcium, magnesium, everything which is found in nature has certain characteristic. But all the more when it is a living thing, it has got a lot of different characteristics. And if you are able to judge as to what is a common characteristic of a group of remedies, then it becomes easier for us to narrow down the remedy in our practice. I always start my lecture with this question, that what is the one thing that we want in our practice? What do we want? Everybody of us, when we start our practice or when we are sitting in our practice in our clinic, a patient comes to us in front of us. What do we want? What do we want? क्या चाहिए हम लोग को? What should we do? Let's make it interactive. What do we want when a patient comes and sits in front of us? Obviously, we want his money. That is one thing. Of course. Yeah, so you will directly jump to that. So, you want signs and symptoms from him. Okay. And how do we get those signs and symptoms? By? You want to know the altered state of the patient. Directly see the altered state. Original state नहीं जानने की जरूरत है. Original state जानने की जरूरत नहीं है क्या? Okay, so because you are talking of kingdoms today, you want to know which group is. So he is going to come and tell us, साहब मैं प्लान किंगडम का हूँ, जल्दी चलो रेमेडी दो फटाफट, मेरे को जाने का है. नहीं. What do we want? What do we want and what does he want? He wants cure by we giving him some medicine. So he wants to know medicine and we also want to know the medicine. Right? Patient आया, we want to know what medicine to give him. It would have been so nice if patients would have put on a label or tag like they on them, like they have when you ask them their name, address, वैसा ही है बोलता, yes, name, address, blood group O positive, and my constitutional remedy is lachesis, or my constitutional remedy is platina. We wish it would be so simple and easy, right? Okay, चलो ठीक है, fine. Government का ऐसा form fill करके just for the sake of patient satisfaction थोड़ा examine किया, stethoscope लगाया और इधर उधर देखा तरह. The best funny thing is, you start telling people that, सांस लो. You put the stethoscope and you tell the patient, सांस लो, and the patient looks at you very funnily and sometimes you realize, what, क्या हो गया? सब ये अंदर डालने की जरूरत नहीं रहती क्या? Because we are so much into routine, because we have to examine the patient for the sake of examining, sometimes most of the time we do. So ये अंदर डालने की जरूरत नहीं रहती है. And then you tell, नहीं ये latest stethoscope है, अंदर डाले बिना ही सुनाई देता. Immediately you have to say something. Na? Sometimes you touch the patient's pulse and you are putting a finger on the patient's watch and you see tuck, tuck, tuck. You feel very clockwork like exact 60 pulse, and then suddenly you realize the hand is on the clock and that is what is ticking rather than the pulse of the patient, because it's like that. So we do a lot of things, but the thing that we want, everybody in practice wants, is that what is the patient that was come to us, we want to know the remedy as easy as possible. Because the patient does not mind how you find out the remedy. Okay? उसको सूंघ के दवा दो, उसको कोई फर्क नहीं पड़ता है. आप उसको पेशेंट को सूंघ के दवा दे दो, ये लो दवा लो, ही विल नॉट माइंड, ओनली थिंग ही विल थिंक डॉक्टर थोड़ा ऑड है, बट एज लॉन्ग एज ठीक है दवाई से अच्छा होता है तो मुझे क्या फर्क पड़ता है। सूंघ के दो, पूछ के दो, बिना पूछ के दो, आंख बंद करके दो, उसका होरोस्कोप लेके दे दो, लेकिन कैसे भी दो दवा, लेकिन दवा सही दो, सच्चा दवा दो ताकि वो ठीक हो जाए। सो दैट इज व्हाट वी वांट, बट दैट इज द बिगेस्ट प्रॉब्लम दैट वी हैव, राइट। एंड टू डू दैट व्हाट डू वी नीड टू डू? Yes, very good. We need to have a proper case history. So what I call is that a job well begun is half done. And when is it half done? When you take a proper case history. This is the most neglected part of homeopathy. And this is the most boring part of homeopathy. Later on, as you grow into practice, then you realize, if you are really interested in homeopathy, then you will try to enjoy this part of our job. But otherwise, most of them, I have assistants with me and who literally fight outside, tu case le, tu case le, tu case le. Initially they are fighting, main lete hu, main lete hu, main leta hu. For after a few days, after 2-3 months, when they start thinking that oh ab to aa gaya sab, pulsatilla, lachesis, calcarea, these common remedies, when they start knowing, they think abhi to kya same hi hai. So then they started, you take and you take. Initially I want to take and later on it is you take. So I had to make a rule, everybody has to take a case turn by turn. But this is also, it's the most boring part of our practice, but it is the most important part of our practice. And for this you need to then ascertain ways and need to enjoy your job or enjoy the ways of how to take this. So the most important part is, first is the case taking, which of course we know every college teaches us. We have their different formats. You can have the big books, you can have the standard question reply. There are some doctors who give this question sheet, ghar se bhar ke leke aao, yes, no, tick mark, you know. So that is, everybody has their own way. Fine, don't worry about it, don't bother about it. You find out the way which suits you, whatever suits you. But the fact of the matter is that you need to get information from the case taking which is pertinent, important and characteristic of this patient. Don't fill a government form of name, age, address, sex, क्या होता है, कब से होता है, कितना टाइम से होता है, कभी ज़्यादा होता है, सर्दी का किससे ज़्यादा होता है, you know, doctor, the patient looks at you. Obviously साहब सर्दी ठंडा खाएंगे तो सर्दी होता है. We all know that. ठंडा खाने से सर्दी होता है, and that's what you write, and that's what the history, usually the assistant bring. Sir, he is aggravated by cold drinks and is better by warm. अरे वो cold, obviously aggravated by cold drinks is nothing new. And then अभी तो नया चीज़ है, खट्टा खाने से होता है, non-veg खाने से होता है. That's it. So you always have this standard modalities wherever you go. That is not what we want. We want the information which is characteristic to this patient. So the one mantra you need to remember when you are taking a case is, you can take case any way you want. You can look at his horoscope and give a remedy. Find out what is characteristic in this man or this woman who is sitting in front of you, which will differentiate him from others. My question to my patients is, when they, after all my assistants bring 10 pages history, which ultimately does not make any sense to me many a times, because it is always, yes sir, he likes company, he doesn't like company, at times he gets angry, at times he doesn't get angry, at times he wants company, at times he does not want company, at times he keeps mum, at times he likes to be in company, at times he gets angry, he speaks out, at times he doesn't speak out, depending on the situation. यही चलता रहता है हिस्ट्री में, depends जब कैसा situation क्या है. Everybody has to survive in this world. Everybody has to find out a way of living. So yes, if your boss is strict and you want your job, your boss is wrong, still you will say yes sir, no sir. हाँ sir, ठीक है sir, okay sir. Even if he says something which is not your fault, he scolds you, you चुपचाप listen because you want a job. So that is not going to give you the right history. So you have to find out. So my question at the end of every patient's history is, summarize yourself in few words. So the most important words which come out in the history right away, at the beginning, at the end, are the most important. And secondly, I tell them, how are you different from everybody else? Just tell me that. And that's all you need to know. Individualization, right? We need individualization, where we need to find out how this Mr. A, B, C or X, Y, Z who is sitting in front of me, is he different from everybody else? And that is the remedy. So it's a simple job, but it's unfortunately it's not that simple. So now we all want to know what is the remedy that this patient who is sitting in front of us, what is the remedy? How do you arrive at that? So first of all, The first part of the job is take a good case. Once you have taken a good case, you have good information. Now analyze this information and try to find out this remedy. So if you analyze the case, you can arrive at the remedy. Now again, there are many methods for this also. Somebody will say particulars are important, somebody will say generals are important,